Right now, there are more than 1,000 isolation beds that have been set aside in Machakos. A temporary stadium has now been converted into a temporary hospital. The governor, though, was decrying bureaucratic delays. He feels that this would have been open earlier on. So with the COVID-19 cases surging towards the tipping point, hospital resources worldwide have been strained and the need for more places to house the patients. Places where large crowds gathered for sports and entertainment events are now being transformed into field hospitals as the world combats the spread of coronavirus. In Kenya, the county government of Machakos will now be using its sports facility, that's a Machakos Stadium, to house COVID-19 patients. The county government says that the stadium offers more room for isolation and also minimizes the issue of cross-infections in hospitals, as Enoxicole reports.
10 minutes to noon, and Henry, a nurse at Machakos Hospital, drags a patient monitor, fixing it to one of the hospital beds. But this is not your usual hospital facility. It is a makeshift field hospital at Machakos Stadium that has provided space for more beds and medical supplies for the treatment of COVID-19 patients. Machakos County has converted the sport arena into an isolation center with men and women wards to deal with an anticipated surge in the coronavirus cases.
We have to be ready. And to be ready is to make sure that we have everything in place even before we get the cases. In case they come, we are praying to Mwenyezi Mungu zisikuje, lakini zikija zitakuta kwamba Mutua na kaunti yake tuko tayari.
As at Monday, a single dome with room for 400 beds had been erected and equipped with facilities, but the stadium provides more space for expansion if need be. The county government says the football pitch can accommodate 2 more domes, increasing the number of hospital beds to 1,000. The makeshift facility will offer room for patients with mild and moderate symptoms, with severe cases being transferred to the ICU at Machakos Hospital, just several meters away.
Ukiwa uko mild, moderate, unakuja hapa. Unatibiwa hapa. Ukitaka drip, unapewa hapa. Ukifikia severe sasa, unapelekwa mahali tuko na another isolation ward, ambayo ni ya severe, ina more machines. Ukiwa critical, unapelekwa huko kwa ventilator, iko na more machines.
Now, according to the county government of Machakos, the whole idea of setting up an isolation center at the stadium is to isolate COVID-19 cases from patients suffering from other diseases. The number of infections have been rising in the country, with Machakos registering 7 cases by Monday. There are worries that Kenya's healthcare system may be overwhelmed with a surge in cases. The country has a shortage of doctors and paramedics, as well as critical medical equipment like ventilators to deal with the outbreak of COVID-19, the potentially fatal respiratory disease caused by the coronavirus.
You don't need a ventilator for every person, because out of 100 people, maybe 1 or 2 may require a ventilator, or 3 at most. And once they use a ventilator and they are cured, that ventilator is used by somebody else. So we already have 10 ventilators that are functioning. We are procuring another 10. We'll have 20. If we need, we've got an open line, we'll get more.
The strategy of converting stadia into isolation centers was undertaken in China, followed by Australia and Brazil. Machakos Stadium, famous for hosting the 2014 FIFA World Cup final in Brazil and the closing ceremonies of the Olympic Games 2 years later, was fitted with hospital beds to treat those infected with corona. Enoxicole, Citizen TV, Machakos County.